thank you very much for joining us tonight, Dr. Lynn.
Great. Thank you so much, Jon, or Infertility Man, or...
Yeah, that's right. That's right. I do have to start this off. I just have to say thank you very much from the bottom of my heart. Every day goes by and I look at my little Adeline and it just blows me away. So I really appreciate what you did for us.
Oh,
so, yeah.
Congratulations.
Yeah, thank you.
I keep following you on Instagram and watching her grow up. She's beautiful.
Yeah.
How old is she now?
She's 8 months, believe it or not.
Wow, that's amazing.
Yeah, it flies by. It flies by.
That's gone so quick.
Yes, I know. People told us, but anyway, it's we digress. But so tonight we're talking about infertility. Obviously, Infertility Man, we focused on the male aspect, but rest assured, people, there is going to be benefit for both men and women tonight. Lynn, we might be forced for a bit of time because we've actually got a lot of questions.
Yeah, so all those questions.
Yeah. We have a lot of questions and they've come from all the different forms. So I guess give us a quick spiel, your 30-second elevator pitch. Who is Dr. Lynn Burmeister? And for those who don't know, who are joining us tonight.
Okay, so Dr. Lynn Burmeister is also known as the Fertility Queen.
Yes.
So I think Sonia Kruger nicknamed me or gave me that name when I helped her get pregnant. And I've been doing fertility for a long time now. So I started my training in I started my obstetric training in 1990, somewhere around there. And then Carl Wood, who is the founder of IVF in Australia, he sort of took me under his wing and got me into doing IVF, and that was around 1998. And then on top of that, so you do your obstetrics and gynecology training, but on top of that, you then have to do an IVF degree as well, like an infertility degree. So I've done my my certificate in reproductive endocrinology and infertility. So that takes 2 years, or 3 years actually, with another big exam. And I spent a couple of those years in New York and worked in a really great clinic in New York and had a really great boss over there who taught me so much. And so then came back and worked back in at Monash IVF for 3 years. But now, as you know, I've got my own company, Number One Fertility. So yeah,
that's fabulous. That's fantastic. So when you go into IVF, you definitely go in the trenches. You have definitely been in the trenches, Dr. Lynn. You've really put in your time. So I guess we might as well kick this off. These questions are in no order, and we actually haven't changed them. So hopefully I can actually give them credit. So we've broken them down into some sections. So this male side of things. So I think we've found that in this process, a lot of people have approached us and mentioned, and what we found is the actual sperm testing for men is quite late in the process sometimes when people are actually on this infertility journey. So I guess the question is, when do you believe that men should have their sperm tested? Or starting the testing process?
Well, they do say that you should start testing. So if you're under 35, you should start testing if you've been trying for a year. But that doesn't really make sense, does it? Because you could be trying for a year and have no sperm. So maybe
that's exactly right.
Maybe it should be more of like a pre-pregnancy consultation. Okay, we're going to start to have a baby. What do we need to do? And I would say that they need to see a doctor who, is good at doing those pre-pregnancy consultations. Doesn't have to be a fertility specialist, can be an obstetrician, or it can be even our fertility GPs that work in our clinic. And there's certain things that you should check out before you do become a baby. And one is that you're ovulating. So no point spending a year trying to get pregnant and you're not ovulating. One is that you guys, there is sperm there, so a sperm test. And then I would say just a basic pelvic ultrasound to make sure there's nothing inside the uterus or the ovaries that might stop you from getting pregnant, rather than wasting a whole year. Because we might say that 30 is young, but sometimes we have 30-year-olds that come into our clinic that have really bad eggs or low eggs. And you might also want to get your egg bank test as well to see if there's some urgency for you to get onto a fertility treatment. And then we also talk about pre-genetic screening as well, to make sure that neither of you are carrying a gene that can make your baby unwell, basically. So I think all those things are very important. And then getting on your prenatal vitamins as well. So that's, you need a good, when you're thinking about having a baby, you need a good pre-pregnancy consultation.
And do you think the information that's out there at the moment, do you think it's up to date?
No, I don't.
A lot of it, okay.
Yeah, I think that people need to do the pre-pregnancy consultation. I think that's very important. I think a lot of people, I had a patient who had a cystic fibrosis baby, and she didn't even know what cystic fibrosis was when the baby was born, and the nurse told her, your baby's got cystic fibrosis. She had no idea, and no one told her to get the test. And so that's why I think you need to have a really good pre-pregnancy consultation. Make sure you're ovulating. As I said, sperm's normal, nothing wrong with the pelvis. And I do the genetic testing. It sounds expensive, but it's worth it. Yeah.
Okay. And if you're, because I know your clinic offers egg freezing. Can these tests be actually, because some people don't have partners, can you actually get this information from doing something like that, like an egg freezing cycle, and you get that information?
The egg freezing, we often don't offer the genetic test, but we send them information. A lot of people egg freezing don't take that up because they're just very focused on their egg freezing. And also maybe in 2 years' time, we're going to even have a better genetic test than what we offer now. So the genetic test can be quite expensive. And who knows, in 2 years' time, we might have a genetic test that does 1,000 genes. So I think for egg freezing, maybe not, but certainly the egg bank and the pelvic ultrasound. And a lot of egg freezing girls are very shocked about how many eggs that they don't have. Like, you know, there was one poor patient today who's been through her egg freezing and only had 4 follicles. Like, that's not many. And she was very surprised about that. Yeah.
I remember, if we go right back to our first ever, attempt, and we were astonished at the lack of follicles when we actually started. So, and that actually led us to you and the crew that actually helped us. So, all right, thank you very much for that one. We'll move right along. So, when you see men faced with infertility, do you have any concerns for them? Are there any biggest concerns or more important concerns for them if they've been given the infertility diagnosis, I guess?
They don't often handle it very well. So it's a very hard conversation because they don't often handle it very well. It's very difficult for many men to be told that their sperm is very poor and it's not functioning properly. And that's probably getting into the egg. I think it's a very hard conversation to have with a guy, to tell him that the sperm is actually the problem, because I think they don't feel manly, or they might feel that way. And then they feel like they're letting their partner down, and you know, and then the partner actually has to go through all that hard work of the injection, egg collection, and I feel like some men feel very guilty about that.
I know I went through that, the burden of treatment. Lay with Laura once I'd had my procedures, and it still lies with her, actually. I should say. All right, yes, and we get a lot of that in the men's group. We talk about that a lot, and I think that it comes back to offering support, and I think we'll get to that later on in a question.
I think there's not much support for men going through fertility treatment, so we are going to build a male infertility clinic.
You are, yes. I remember talking about this as you've been building up your practice. So yes.
Yeah, so that will hopefully open in the next 6 months or so, and that will be just a clinic dedicated for men.
Fantastic.
and you know, we'll
Necessary.
probably have someone like Darren Katz if he wants to come and consult
Yeah.
there.
Yeah.
A urologist that specializes in male factor infertility, because not all urologists do specialize in male factor infertility.
Yeah. Yeah. I think that's very necessary.
Yeah.
All right. The next category, it says egg and sperm quality. Now, when we're looking at sperm, odd-shaped sperm, is there any way that we can actually improve the quality of the odd-shaped sperm or the amount of the volume?
Well,
at all?
Yes. So if you've got a diagnosis of abnormal sperm, your doctor should organise for you to have a testicular ultrasound, and then should organise a hormone profile. And sometimes on the testicular ultrasound, we might find things that are causing you to have poor sperm, like varicoceles. So varicoceles are like varicose veins in your testicles, and they overheat the testicles and cause sperm problems. So then we send that patient off to get assessed by a urologist to see whether those varicoceles need clipping. And if they are very large, they do need clipping. And that will improve the sperm. And the other thing that we might find sometimes is testicular cancer. And that can make the sperm abnormal. And I've picked that up probably 10 times in my career, and I've actually saved guys' lives just by doing the ultrasound. And then the other thing is the hormones, because you might have a hormone problem that's causing you to have low sperm, and we can actually fix that up by giving you hormones. And the other thing is lifestyle. So if you're smoking, drinking, you're overweight, you're snorting cocaine, you're going to have bad sperm. So we have to talk about lifestyle. And then I tell a lot of my guys to actually ice their testicles once a day, for just 20 minutes. Get an ice pack, roll it in a towel while you're sitting watching TV. Just plonk it on your lap. Don't get frostbite, please. So not too cold, but just cools down the area, because we know that overheating the testicles lowers the sperm count. I think you did that too, didn't you?
Yeah, I was doing that when I meditated morning and night. I'd just get a chill downstairs, and well, I'd like to think that added to the outcome. So All right, that's comprehensive. So this next question from Instagram: does psilocybin, so these are magic mushrooms, impact male or female infertility or fertility?
Right.
Now, this is quite a specific question, so I'm not sure whether you've come across this about magic mushrooms.
Too many people tell me they take magic mushrooms. I don't know where you get them from, but I would imagine it's probably not good for the DNA of the sperm or the eggs.
Right.
And remember, you're making I like Tasha Jennings. She always talks about Olympic athletes. So we want Olympic athlete egg and sperm.
Yes.
We want them to create Olympic athlete, embryos, so that those embryos are going to, implant or give them the best chance. And I think if you're doing things like cocaine, magic mushrooms, excessive alcohol, you're not going to, you won't be creating Olympic athlete egg or sperm.
No, it would probably slow them up a little bit.
Yeah.
Yes. All right. The next one. So is there anything someone could do before giving a sample that could help increase their sperm count or sperm number?
Yes. So all those things like lifestyle. So important to, if you're overweight, you often will have lower sperm. Bike riding for hours squashes the testicles on the bike. And so try and reduce bike riding. Vitamins will help the health of the sperm, but it's not going to improve the numbers usually. And and sitting at your desk all day. I know a lot of guys are working from home at the moment, and they're sitting at their desks all day, and I feel like there is an increased number of bad sperm results coming through. And when I ask the guys what they're doing, they've got very sedentary. They're getting up, they're not even changing out of their pajamas, they just sit at their desk all day. And they're still working really hard, but they're just not moving. So, probably working harder than walking into the office and having breaks now and then. Yeah. Okay. I think we might end up covering these a couple of times, but this is good. It's good repetition.
Next one, do you have any recommendations when it comes to supplements for IVF? Do you find a different recommendation for men and women?
Yeah, so there's vitamins that you can buy over the counter, but a lot of them won't have enough of the ingredient in them to actually make a difference. So sometimes you're actually better to buy your things separately rather than going and buying. I won't mention the names of the products, but rather than going and buying a specific male infertility vitamin, sometimes you're better actually going and buying some zinc, going and buying some vitamin C. Fish oil is very good for sperm. We know selenium is good for sperm. So actually buying them all separate, and that's why I do my fertility boost for men, that it gets compounded and it's got high doses of those things in it.
Of those
and also then adding in fish oil, and we know that folic acid is a really good thing for sperm as well. And then your diet, like a handful of Brazil nuts a day is excellent for sperm, and oysters. As we know, that oysters are good for sperm as well. So, so in your diet, you can do things, and blueberries. I think you used to have a lot of shakes, green smoothies.
Still do, yes.
So, you know, in your diet, you can have a lot of the vitamins and minerals that are going to help but, you know, even if you just pack a handful of Brazil nuts in your bag or every day, your lunch every day, and just eat a handful of Brazil nuts, that's fantastic for sperm.
I know the biggest one for me was the antioxidants, finding the ones with the biggest punch, and I guess the water content remaining alkaline as well, trying to remove that acidity in the body. So
and plastics as well. So we know that plastics,
we did that.
Plastics can affect your sperm and be what we call hormone disruptors. So be careful drinking out of plastic bottles, and change your plastic bottle to a metal bottle. So good thing to try and clean out your kitchen from all the toxins and things. There's a good book that if people haven't read it, it's called Starts with the Egg, but it does talk about how to clean your life out of all the toxins that we actually have. So even perfumes that we spray on ourselves and deodorants probably affect eggs and sperm.
Yeah, I know Laura had me remove the deodorants and the aftershaves and the chemicals we were using in the house, even the soaps and toothpaste, all that sort of thing. It all adds up, and I think it all contributes to the end goal.
And I think that's another thing that people forget is their dental hygiene is important. Well, no, I don't think there's much research for men, but certainly there's research for women that if you've got poor dental hygiene, you increase your risk of miscarriage and preterm labour. So go see your dentist, get your teeth cleaned as well.
Okay. All right, moving right along, we've got this one refers to alcohol. When should men stop drinking before IVF?
So alcohol, as long as they're not doing excessive amounts, then like 5 to 10 standard drinks a week is probably okay. That's sort of what the evidence shows. But if you do go and see a naturopath, they will tell you to stop altogether. If you can stop, that's probably better. Sperm takes 3 months to be created.
3 months, that's right,
you need to stop for the full 3 months before, if you can. But I mean, for some people, that's impossible. So, and you've got to have a life as well. You know, people, now we're out of lockdown, you've got to enjoy yourself a little bit now. And so if you are invited to a party and want to have a couple of glasses of wine, that's not going to hurt your sperm, really.
All right. And can poor sperm create high-grade embryos?
Yes, because the egg fixes up the sperm. So the egg is a very complicated structure, and you can have as long as you've got a good quality egg, once we inject that sperm into the egg and create the egg will fix up the damage in the sperm. And so if it's a good egg, it should repair a poor sperm. And you can see that in the studies using donors. So if you've got a young egg in their 20s and you inject the sperm into it, the embryo still is very good. However, if you've got a 40-year-old egg and you inject a poor sperm into the egg, then the embryo often isn't very good because the egg can't fix up the poor sperm. So that's the problem with having older eggs and poor sperm. They're very difficult to treat. And a lot of men still think that smoking's fine, and a lot of men think that smoking's okay and their sperm looks okay. I've been told my sperm's perfect by my doctor. And they're smoking, but then they have these really bad embryos. So I'm like, well, no, the smoking gets into the DNA of your sperm and clings onto it and creates bad quality embryos. So stop smoking if you're trying to have a baby is essentially the lesson here.
And this next question relates to charting. What's your advice for people trying to conceive naturally using charting and ovulation prediction, for example?
I think that's okay, but often when your temperature goes up, say if you're temperature charting, if your temperature goes up, you've already missed the window. So you've got to have sex before your temperature goes up. And a lot of the apps on your phones are inaccurate as well. I think they miss ovulation. Someone did a study like 30% of the time. So I think charting is good just to make sure your cycle's pretty regular. But what will happen is you'll usually ovulate 14 days before you get your period. So if you are charting, that's how you can work it out. So if you're having a 28-day cycle, it means you're usually ovulating day 14. If you're having a 30-day cycle, it means you're ovulating day 16. So charting's okay just to get some history about what your cycle's actually like. If your cycle's less than 24 days or longer than 35 days, chances are there's a problem there and you might not be ovulating. And definitely if your cycles are getting shorter and closer together, that's even a sign that you could be starting to run out of your eggs because you're using your eggs up quicker when you're running out of them. So that's a bad sign. And so if you do have short cycles or long cycles, then you definitely need to go and get your egg bank tested and make sure you're ovulating.
Right.
Yeah.
Geez, a lot of information there.
Yeah.
The next section is bracketed off IVF.
Yeah.
What's a couple of things a couple of bits of advice you would give men as they go through IVF?
Yeah, so
very broad, I know. Very broad question, but
so yeah, I think be supportive to your partner if you can be. Help them with the injections. That's very stressful. I think just just being very supportive during the process and don't blame yourself for it. 40% of the time it's male factor, 40% of the time it's female factor. And 20% of the time we'll find something wrong with both of you. So in actual fact, it's 50-50 really. And so I think just be supportive of each other and certainly don't blame each other for whichever one has the problem. And often as I said, 21 in 5 will find problems with both of you. So I think it's important not to blame or feel guilty. And it can cause relationship issues. So if one's blaming, if your sperm was normal, I'd be pregnant by now. And, I hear that in consultations sometimes, like the female or the males complaining about, and can sometimes be a difficult conversation because you can see there's a relationship starting.
Yeah, it is important to have that conversation up front and be very clear about, I guess, your feelings for each other, because you are in this together, and it really doesn't matter who's at fault or who's the issue with. You've both made the choice to move forward with this journey. So it takes strength, and you need to look out for each other. Thank you very much for that. What what do people need to understand? Now, this is about the 5 days after egg retrieval. I think it's called the fertilization period. What are the important things people need to understand about that 5-day period?
Yeah, so first of all, we'll collect the eggs, then we'll put the eggs and sperm together. Sometimes when men don't have a problem, we can let the eggs and sperm just meet together naturally. When men have a problem, we have to do ICSI, which is where we put the sperm into the egg. And then the next day you'll get a phone call about how many eggs got fertilized. And then usually the embryos sit in the incubator. We've got time-lapse incubators, so we just go up to your name and push the button and we can see your embryos every day. But the embryo will start showing us whether it's going to be a baby on about day 4, where it starts reaching a stage called compaction. And if the embryo hasn't compacted by day 4, it's unlikely it's going to get to the next stage of being a blastocyst. So that's another phone call you'll get on day 4 from our clinic. Not all clinics do it, but you'll get a phone call about how many embryos have reached that compacting stage and the likelihood of you reaching to the blastocyst stage, which is where the embryo has got the outer cells, which is called the trophectoderm, and the inner cell mass, which is going to be the baby bit. So, and that embryo has about 100 cells by that stage. So usually on day 4, we can tell if you're going to head in that direction.
Yeah. I remember Laura looking at me when we did our first procedure, and I was quite blown away by the numbers. The numbers were relatively brutal, I would say.
Yeah.
Like for us, we had 31, and we were down to, I think, 11 or 9 by day 1 or day 2. So, yeah, that was a surprise. I was not ready for that.
No. And there's often a big drop off. And again, it can depend on the egg quality and the sperm quality.
Yes.
But yeah, what we normally say is if you've got 4 fertilized eggs, we would hope that one of those 4 fertilized eggs will be an embryo. But then, you should have, normally we would expect a 60 to 70% fertilization rate. But then that can be, if the sperm may not be that good quality, then you might have lower rates in that too. And also, as I mentioned, the egg quality too. Right. Yeah. But be prepared for a major drop down. Yeah.
It took my breath away a bit.
Yeah.
Now, you've mentioned pre-implantation genetic testing earlier on in the chat. What do you tell your patients about pre-implantation genetic testing?
So that's where the pre-genetic testing is a pre-screen. The genetic testing on the embryo is like what we used to call it PGD, but now it's called pre-genetic testing. And that's where we test the cells of the embryo. So when on day 3 we start to hatch the embryo, and then by day 5 it usually is hatching out. And we can take some cells off the hatching bed safely and test it for if you've got a genetic problem. We can test it for a genetic problem, or we can check it for chromosome problems. So if you are over 35, we often recommend that because you're going to have more problems with your eggs and increased risk of Down syndrome and trisomy 18 and trisomy 16. So we can do that test. Now, it's not 100% accurate, but it's high 90s. And the pregnancy rates from a tested embryo are higher than an untested embryo. So it's sort of, the science is there that it does work. So if you've got a tested embryo and we put that back in you, your chance of getting pregnant is 55% with a 5% miscarriage rate. Whereas if you put an untested embryo in, your pregnancy rate, depending on your age, but say if you're 33, or actually let's say you're 37, you're putting an untested embryo in, you've got about a 30 to 35% chance of pregnancy, but a 1 in 3 chance of miscarriage.
Yeah. All right.
So testing your embryo will increase your chance of having a live born and also decrease your risk of miscarrying.
Miscarriage, right.
Yeah.
Thank you for that. All right. Now, this is referring to add-ons. what do you think about so-called add-ons for IVF? Now, we're talking about natural killer cells, time-lapse imaging of embryos, and procedures like endometrial scratching.
Right. Okay. Yeah. There's so a lot of add-ons along the way, because it's very difficult when you are an IVF doctor. The patients want you to do something different. Like, why are you giving me 300 of that medicine every single time and it's not working? We want something different, doctor. So then that's where the add-ons came about. So, so endometrial biopsy, we call it now. We do it more as because there's a lot of evidence that perhaps it doesn't work. However, there are some studies that say it may help. And there's been a recent study that said it showed an improvement of 8% in pregnancy rates. So maybe it does help. But there was a big trial that showed it didn't really do anything. But I like doing it, one, because it's like a practice transfer. Two, it tests the lining and makes sure the lining doesn't have infection. And I've also picked up endometrial cancer sometimes, like over the years, quite a few, or pre-cancer changes, which is called hyperplasia. We've picked that up as well. So if you did IVF and you have a hyperplastic lining, your embryo is not going to stick. It won't implant. So you're just wasting your time. So there's a few reasons I do it. And one is also because, like, sometimes you'll go to do a transfer if someone hasn't had one, and they might have a pinhole cervix, and then the catheter doesn't go into the uterus. I want to find that out before I get your embryo out of the freezer. Yeah.
Of course.
So
of course.
That day, the embryo transfer day, is your most important day to get everything right. And if you haven't had any testing and we can't get your embryo in, then we have to freeze your embryo.
Yeah. Okay,
So a lot
that
of
makes
the
a lot
other
of sense.
add-ons like steroids and Clexane and intralipids, they're largely unproven, but they're not, as long as in medicine, as long as you're not doing anything harmful to your patient, then if it might have a chance of working, if some studies have showed it might help, then why not try it? If something else is not working, you've got to try something else. You can't keep doing the same thing over and over again and expect to have different results.
Of course. That makes a lot of sense. Thank you for that. Now this one is the 2-week wait, and particularly for male partners, any advice for the 2-week wait? Particularly for male partners for our side, but it goes across both sexes. So
that's a very difficult time. I think keeping yourself really busy, just like really keeping yourself busy, working. I think people who take time off work in that 2-week wait, I think that's the wrong thing. I think keeping yourself really busy and active. I did do a transfer today, and they were going on a 2-week holiday. I thought, well, that's a nice thing to do. They're going to de-stress, and go on a nice holiday to Lakes Entrance. And I thought, oh, well, that's a nice thing to do, as long as they're not sitting there in Lakes Entrance being stressed every day. But if you can get time off work, and not that it's going to make the embryo stick more, but if you can do something really nice in that 2 weeks as well. But certainly not going home and lying in bed for 2 weeks is not the answer. So, and stressing every day that it's not going to work. And sometimes I know a lot of patients do the urine pregnancy kits, and sometimes they just start doing them too early, and they don't give the embryo time to implant. They're already doing them. That's not a good idea either, because then you already feel like you're not pregnant when in actual fact you could be pregnant. So I think try and avoid doing the pregnancy tests too early.
I think we hid them all away. We actually didn't get any. And that helped us. We just stayed away from that. I just saw a question here that seems quite important. How would cervical cancer affect the IVF process?
So if you've got cervix cancer, often you've had a procedure where they've removed your cervix, and they remove most of it. So then you've got no cervix left. And so then you would need to see a doctor who can put a stitch around the top of the cervix, but they have to do it through the abdomen. So this particular doctor does it. I think he's the only doctor in Victoria that's doing them currently, and he puts a stitch laparoscopically around the cervix from the abdomen, and the stitches are pretty good. But if you don't have a cervix from something like cancer, then it's important you probably speak to your doctor about getting one of these stitches put in. There's pros and cons to the stitch, so that needs to be discussed with as well. But if all your cervix has been removed, then you probably need to consider having a stitch put in.
Okay. Well, I hope that answers your question. Thank you very much for that. So, ovarian hyperstimulation syndrome. What do partners need to know about this?
Yeah, so that's where your partner has got a lot of eggs, and sometimes it might not be a lot of eggs. We've seen it in some women that have only had 7 eggs collected, and it's where you have an unusual reaction to the medication. So it's usually the trigger injection, the HCG. So the trigger injection is like a pregnancy hormone, and it triggers out the eggs. And then what happens is it makes the follicles produce this hormone called VEGF, which dilates all your blood vessels. And what happens is this VEGF factor goes and dilates all your blood vessels and makes your blood vessels leaky. So instead of your fluid staying in your blood vessels, it actually leaks into your abdomen, and also can leak into your lungs. So you can feel like you're drowning because the fluid can actually start filling up the lungs as well. And fortunately, that's very rare, that scenario where you get that sick. The incidence of it is being lowered now, because if we suspect someone's going to get that, we don't give them the HCG trigger. So the incidence is lowering. We are seeing that, and we're very cautious about, because we don't want our patients sitting in a hospital with drain tubes in their abdomen.
Oh.
Yeah. So
wow.
yeah. So it can be life-threatening as well. So people in the world have died from it. So it can be a very serious complication. So we try and avoid that. But sometimes, even though we're being as careful as possible, we still see it. So the incidence is probably 0.5 to 1%. Get the severe form where we have to admit you to hospital.
Yeah. Okay. And that would be during the...
That's after the egg collection, not during...
Yes.
So that occurs after the egg collection, and it might occur when you're pregnant, because the pregnancy hormone stimulates it. So, so you have either the early onset that occurs 2 or 3 days after your egg collection, or you might have a late onset that occurs like 7 to 10 days after your egg collection, because you're pregnant, and your body's starting to produce pregnancy hormone that's powering the VEGF factor to increase and then open up all your blood vessels.
Okay. All right. Well, thank you for that. What is your advice to couples who receive an unwanted result at the end of their IVF cycle?
I know that's very depressing. That's my failed. Yeah, that's a tough day to sit through. That's my failed patient day. And you know, not every IVF cycle is going to be successful. Unfortunately, we all know that. So, and most of the time the stats are against you. So, you know, unfortunately, we know that the stats are usually you won't get pregnant, then you will get pregnant in an IVF cycle. We know the stats for a negative result are higher than for a positive result. And that depends on your age and your circumstance as well. So sometimes it may take 3 or 4 embryo transfers for you to achieve a pregnancy. And that, again, is age related. If you're over 40, it might take 6 to 8. And if you're over 40, we may never find you the golden egg, unfortunately, as depressing as it is. The golden eggs might have all run out. So I always call them the golden eggs. But if you're under 40, we hopefully have good chance of finding you the golden egg to create a baby. But yeah, that's a very difficult day, my failed patient day. You know, again, we go through everything. We make sure that we've done all the investigations. We might do tests to see if there's something wrong with your implantation or your implantation window. I might send you to a physician to see if he can find any underlying autoimmune condition that might be stopping the embryo implanting. but often it's usually about the embryo and the embryo quality. And that's the most likely reason an embryo is not implanting, is there's something wrong with the embryo itself.
Okay. Okay. All right. Well, we've got a question here. There's a GP worried about freezing eggs because of the BRCA2 gene. He said that hormone injections can trigger cancer. Is there any truth to that, Dr. Lynn?
Yeah, so the hormones are, well, they have done long-term studies and 20-year long-term studies, and they have shown that IVF patients are at no increased risk of ovarian or breast cancer. However, if you do have the BRCA gene, we do give you high doses of follicle stimulating hormone that are going to cause high doses of your estrogen. So if I do have a patient who has the BRCA gene, I usually put them on letrozole, which is an aromatase inhibitor. So basically what that does is it gobbles up the estrogen. So when you've got the patient on letrozole right through their cycle, their estrogen remains very low, actually. Right. So anyone at risk of breast cancer, I give them that treatment. Right. Or anyone that's egg freezing because they do have breast cancer and they have to go on chemotherapy, I combine it with letrozole as well. Yeah.
Okay. Okay. Well, hopefully that answers that question. What would you test for someone who is having continuous implantation failure? Let's say the HCG rises and then it drops and becoming a chemical pregnancy.
Yeah, that's a very difficult situation. So one, we would want to make sure that the embryo is normal, like that they're putting in normal embryos, so embryo testing. And then if you haven't had an endometrial biopsy, you probably need one. Sometimes we might suggest a hysteroscopy or even a laparoscopy if you haven't had that done before, because sometimes people have diseased tubes that aren't found on ultrasound. And when we go in and do the laparoscopy, we find these things called hydrosalpinges, which are fluid-filled tubes that leak fluid into the uterine lining and stop the embryo implanting. So we sort of just want to be thorough with the investigations. We might, suggest that to you. And there's another test that we commonly suggest is the ERA, Emma, and Alice test, which is like a receptivity test to make sure the day that we're putting the embryo in is correct. And also check the microbiome of the lining. Some people have bacteria in their lining that's stopping the embryo implanting. So we want to check that as well if we're having repeated failed implantation.
Okay. That's very comprehensive. Someone keeps mentioning Inositol. Have you heard of that at all? Inositol? I believe it might be a medication, but I'm not sure.
I think Inositol. I think they might be asking. Inositol is often given.
It says Ovasitol. Ovasitol.
Yeah, it might be a brand name to improve egg quality. Yeah, I would say that. But Inositol is often given to women with polycystic ovaries to improve their egg quality. So it might be a company that's made a vitamin particularly to improve egg quality. Right. So just look at the amounts in the things though, because sometimes the amounts are so small that they do nothing. So sometimes it becomes about marketing rather than actually about what it actually does. So okay. Very easy to get sort of sucked into this world of IVF and buy all these things that actually don't work. So it can be a big can of worms. A bit like the test that's going around, the DQ alpha test, and then the couples find out they're too much of a perfect match, and then now we need a surrogate, and there's no proof of any of that, and that's actually. That has actually been unproven. So there's no, and then what happens is they get the partner's white cells and injected into their arms, and again, unproven, could be dangerous, could cause long-term problems to the health of the woman. So definitely would recommend that. And in some parts of America, it's actually being banned. So I'm not doing it. Yeah.
Okay. All right. Well. This one is about grading of embryos. Maybe just a quick rundown on those. I know there's some people waiting on embryos and have their embryos in the freezer. How do they rate? How do you rate them?
Yeah, so we have 3 different rating systems. So the embryologist is the one that will give it a 5AA or a 5BC or a 3CC. So that's the embryology rating, and that's based on how the embryo looks to the embryologist. And then the other grade that we have that's inbuilt into our beautiful EmbryoScope Plus, and we were the first clinic in Victoria to be using this, but that gives it a KID score, KID score, and so that's looking at the embryo, and then the EmbryoScope gives us a score on that. And now we have artificial intelligence also built into the EmbryoScope Plus called IDA. It's a new one, and IDA it gives us a score based on it's learnt. So it's basically looked at hundreds of thousands of embryos and then the pregnancy outcome, and so it's learnt how to recognize an embryo that's going to implant. And if you get an IDA score over something like 90%, or not, it's out of 10, so it's safe to get over 9, your chance of getting a baby is like 60%. So really good stuff coming out for IVF. Stuff that we didn't have before. There's
a lot of tech. I know 5 years ago, if I was there, I wouldn't have a child if it was 5 years ago. My procedure is relatively new, so the technology is just amazing at the moment. It's just
and it's changing all the time. And we're, there's going to be a new ICSI that we're going to do shortly, which will have a smaller needle and using a different way to do the ICSI rather than injecting the egg like that. So because sometimes that can be damaging to the egg. So there is a new ICSI being the Japanese have developed it. I'm pretty sure the Japanese developed it, but so there's a new ICSI coming along shortly. We're just waiting for TPS approval.
Very cool indeed. Very cool indeed. Well, we're down to the last few questions. Your thoughts on doing IVF while breastfeeding?
So none of the IVF medications are listed as safe. So that's the concern. I know a lot of patients still do it, but if you read the packets on your FSH injections, for instance, they're all class D, and they're not safe in breastfeeding. Even letrozole's unsafe in breastfeeding. That's a tablet we use for ovulation. But if you're doing a natural cycle and you're getting your periods regularly and you have your frozen embryos, then that's fine to do a frozen embryo transfer if your periods are coming naturally. That's fine.
Okay, that's good knowledge. Does a woman who has an AMH of 1 have any chance of getting her own eggs?
That is very difficult. So yes, having a low AMH is very, very difficult, and very difficult to treat. And particularly if you're in your 40s with an AMH of 1, the chance of probably getting pregnant then would be about 1%, I would say. If you're in your 30s with a low AMH, even if we get 1 egg off you, your 30-year-old egg is still a 30-year-old egg, and so you still have a reasonable chance of having a baby. So it's just that's more to do with age. If you're older and a low AMH, it's very difficult to get you pregnant.
Okay. One of the last questions, are there any long-term effects of doing IVF more than 6 times?
Well, again, no, but I suppose each time you're doing an IVF cycle, you are increasing your risk of surgical complications, and that could be infection or bleeding or a pelvic abscess. But as far as cancers and long-term health risks like that, no. And remember, we're not using up your eggs. Some people say, oh, Dr. Lynn, but you're using up all my eggs. Every month you have a pool of eggs, and at the end of the month, those pool of eggs have died. So all we're doing is egg rescuing. So we're rescuing those eggs that were going to die. So I call it an egg rescue mission.
Right. Okay, we're down to the last couple. There's a couple up here. What's your biggest tip for preparing for a transfer? Like, should people stop drinking sugary drinks and, well, anything the like.
Yeah, I think that just being really as healthy as possible, meditating, try and find a meditation that you listen to every day that's really positive, like that gives you positive, vibes and positive thoughts. So getting your mind in the correct, mindset for that embryo transfer day, being relaxed as possible. Don't come into the clinic being stressed out. And that's why we have our clinic set up so that it tries to relax people. Acupuncture might help. Some people love acupuncture. Some people hate acupuncture, but there are some studies that acupuncture on the day of your transfer can help as well. I don't think French fries really do help, but a lot of people go off and buy McDonald's French fries. But if they make you happy, we do know that happiness does improve your chance of success. And that's been shown in a study by people being shown clowns after their transfer, making them laugh. And those people had a higher chance of getting pregnant. So go home and watch a funny movie, something that's so ridiculous you'll just laugh all your way through it is probably a good idea. And yes, laughing will not push your embryo out.
All right. So, good. Good. We're down to the last couple. So do you recommend, does melatonin help improve egg quality, or is that about the sleep side of things?
I think there's definite benefit to melatonin. It's a very good antioxidant. It's like anti-aging as well. So and it does help you sleep as well. And maybe it is to do with something that we know lack of sleep causes aging. And we know lack of sleep causes poor sperm and poor egg quality. So maybe it's got something to do with that as well, that gives you better sleep. Okay.
Well, we're really in the trenches now. What is the wait time from an egg collection and PGA testing of embryo to then transferring?
It depends. Like during COVID, we had some slow months, but we're pretty much back to normal. And usually we'll have the result within 2 weeks. The longest it's probably been is 3 weeks, but a lot of that was because of COVID stuff. Yeah.
Okay. And if someone's period comes back early after egg collection, can they safely do a transfer the next cycle?
Usually, but if we're waiting for your PGT results, we'll ask you to wait that month because we don't want you to start and then get told all your embryos are abnormal or something like that. Yeah.
Okay, well, I think we're almost done, but there was one question here. For a nurse that wishes to start a career in fertility, do you have any recommended courses that would be desirable as they start?
Yeah, well, I think that there's a few courses. There's a Masters in Reproductive Medicine through New South Wales University. That's quite a good one. But I think just coming and getting a job with us and we'll teach you everything you need to know is really the best thing. Learning by experience. And I know that the nurses who get to sit in with me during my consults, which I always have someone there usually, they learn a lot. And just working in our clinic. So if you are a nurse, we are looking for nurses. So if anyone's a nurse out there and wants a job at One Fertility, please give us a call because we're looking for new nurses.
A little bit of a plug. That was great. That's great.
Yeah.
One thing's just popped up here, and I know I had questions about it. Essential oils during an IVF cycle. Are there any do's and don'ts?
Yeah, that's an interesting one because they do, they've not been proven to improve fertility and they are quite smelly as well. So whether they fall into the perfume category and whether we should not be using them. But I would probably say maybe stay away from them because they are, there's no proof that they are actually safe to your eggs or your sperm.
Yeah. And the last one, well, at the moment, are almonds of any benefit to a man's sperm?
Yeah, almonds are great. They're a great snack. They're full of protein. Yeah, almonds are great for.
Is it zinc as well? Almonds?
Yes.
Is it zinc as well?
Yeah. But I think Brazil nuts have a higher amount. Yeah. So just a bunch of nuts every day is good for your nuts.
Yeah, that's great. A bunch of nuts is good for your nuts. I think that's a good catch line. Dr. Lynn, I really appreciate, I think everyone appreciates you taking the time to have a chat with us. I do have one last it was actually a message sent to us, and they asked us to read it to you. And it says, Dr. Lynn, you are an incredible human and doctor, and genuine care pours out to us all. And that was from one of our followers and one of your followers. So
that's beautiful.
We really appreciate you taking the time. We really appreciate what you've done for so many people and what you continue to keep doing. I guess if you've got any more questions, maybe just send them to Dr. Lynn or to Infertilityman, and we'll endeavour to get them answered. We are trying to get all this information into this book we're trying to put together for people. So it's just we're just trying to create a space and support not only the men, but the men that are supporting the women and the women. So it's just just help each other. The world needs kindness right now, and we really appreciate you taking the time tonight, Dr. Lynn.
Oh, that's a pleasure. And I hope you can join our Fertility Queen event, our high tea event, and come and give a talk that day to all the people that are coming. So men and women are both welcome. It is called a high tea event, and we're holding it in May, end of May. I will announce the date. We're just trying to sort that out. And so we're very excited. And we might even have donations go out to, to people suffering now in the Ukraine. I think it's very important to support our Ukraine friends, and we know some babies are stuck over there right now, and people are trying to get their babies out. So God bless all those people suffering right now, and thank you so much for having me on. It's been very lovely. And I love everyone who is my patient, and thank you for believing in me and believing in our clinic.
Yeah, thank you to everyone, and thank you, Dr. Lynn. We will see you again very soon.
Yes.
Take care, everyone.
Bye, John.
Bye.
Bye.